Hey everyone, welcome back to our YouTube channel, Rick Mekha. Myself, Upasona Panday, second professional MBBS student from NRS. In this video, we will be going to discuss about the explain whys from our abdomen. Okay, so let's start with the first question. It reads that appendix is said to be the abdominal tonsil. So first of all, what is the tonsil? Now, this is a structure which is formed by the lymphoid aggregations. Lymphoid aggregations. Okay. And what is the function of the tonsils? Now, it traps the microorganism and prevents infection in the body. Now, why appendix is said to be the abdominal tonsil? Because if we go through the structure of the appendix, then we will find that the wall of the appendix is composed of serosa, muscularis, submucosa, and mucosa. In the submucosa coat, there is lots of lymphoid aggregation. Lots of lymphoid follicles are present, and this prevents the infection of the abdominal cavity. So, appendix acts as a tonsil present in the abdomen. Hence, appendix is said to be the abdominal tonsil. Now, the next question is that carcinoma of the head of the pancreas may cause jaundice. So, let's look at this picture. Okay. So, this is a diagram showing the pancreas, and this is our duodenum, and this green colored structure that ultimately goes inside the duodenum, this is our common bile duct. Okay. And for the pancreas, this is the head of the pancreas. Here there is the neck, this is the body, and somewhere here is our tail. Okay. Now, this bile duct, this common bile duct carries the bile from our liver and the gallbladder and drains it to our duodenum. This common bile duct has a supraduodenal part, a retroduodenal part, a infraduodenal part, and a intraduodenal part. This infraduodenal part, it lies behind the pancreas. Now, when there is a carcinoma of the pancreas, the head swells. The head of the pancreas grows in size and compresses the common bile duct. Okay. Now, as a result, what happened? Now, the bile which was flowing through this duct is getting obstructed, and this leads to obstructive jaundice or post-hepatic jaundice. Hence, the carcinoma of the head of the pancreas causes jaundice. The next question is the cancer prostate with low back pain. So, to understand this question, to answer this question, we have to look at the venous drainage of our prostate gland. This is a beautiful diagram showing the venous drainage of our prostate. So, this is the prostatic venous plexus where the blood from the prostatic gland, so prostate gland, drains into this. Then this is carried to the vesical venous plexus. The deep dorsal vein of the penis joins with the prostatic venous plexus and drains into the vesical venous plexus. And from the vesical venous plexus, this blood drains into our internal iliac vein via the posterior ligament of the bladder. Okay, this is the normal blood flow. And now, some of these veins from the prostatic venous plexus go and drain into the vertebral venous plexus. Okay, internal vertebral venous plexus via the paravertebral veins of Batson. Now, this blood flow is not the normal blood flow. This blood flow does not occur at every time. Whenever there is increased intra-abdominal pressure, then the blood from this prostatic venous plexus, instead of going into its normal path to the vesical venous plexus, it goes to the internal vertebral venous plexus via the paravertebral vein of Batson. Okay. Now, if there is any malignant growth in our prostatic gland, then that malignant cells can move to the vertebral venous plexus via this path, and that will lodge the malignant cells in our vertebra, and that will lead to back pain. Okay. Now, let's go to the next question. That is, which ureter is more prone to injury in cancer cervix of the uterus? To answer this question, we have to look at this diagram. Look, so this is our uterus. This is the cervix. Okay. Now, due to the pressure from sigmoid colon, the fundus of the uterus tilts to the right, causing dextro rotation of the fundus, and as a result, the cervix tilts to the left, causing levo rotation of the cervix. Now, you see, this is the ureter and this is the uterine artery. Now, when this cervix tilts to the left, this comes more approximated to our ureter, and if there is any malignant growth in the cervix, that will lead to compression of the ureter. So left ureter is more prone to injury in case of cancer cervix. Okay. Appendix of the testis is embryologically different from the appendix of the epididymis. Why? Because the appendix of the testis is the remnant of the cephalic part of the Mullerian duct, whereas the appendix of epididymis is the remnant of the cephalic part of the mesonephros. So these are embryologically different from each other. Now the next question is that pleural sac may be accidentally opened during exposure of the kidney from back. Yes. Why? Let's look at the posterior surface of the kidney. So these are our kidneys, and this strap you see, this is our erector spinae muscle, and this is the 12th rib, and this dotted margin, this shows our costodiaphragmatic recesses of the pleura. Okay. Now this is the lateral border of the erector spinae muscle, and this is the lower border of the 12th rib. At their junction, the angle which is formed, this is called the renal angle. And in case of any surgical procedure, we have to pass the needle below this renal angle or at this renal angle. Okay. Now, sometimes what happens, this 12th rib is so small that it does not encroach the lateral border. It ends somewhat here. So in that case, we won't get the 12th rib. We will mistake in the 11th rib as the last rib, and we will think that this is our renal angle, and we will pass our needle here, and you see this will cause puncture in our pleural sac. How to prevent this? Now we have to count the ribs from our sternal angle, from the second rib. Rib counting should always start from the second rib to prevent any kind of accident to our pleural sac. Okay. Now the next question. Pubic tubercle is important landmark for femoral and inguinal hernia, because if this is our pubic tubercle and this is the lateral side and this is the medial side, then this is our femoral ring and this is our superficial inguinal ring. Okay. So let's put this up. Then this is our inguinal canal and this is our femoral triangle. So we can clearly see that this pubic tubercle demarcates the lateral and the medial position of the femoral and the inguinal hernia. The femoral hernia lies lateral to the pubic tubercle, and the inguinal hernia occurs medial to the pubic tubercle. Hence, this pubic tubercle plays an important landmark for femoral and inguinal hernia. Okay. In prostatic carcinoma, extreme lumbosacral vertebra is to be avoided. This is the same answer to this cancer prostate with low back pain. Okay. The next question is, dropping of the kidney is not followed by suprarenal gland. Why? Because this is our renal fossa. Okay. This is our renal fossa, and it has one anterior layer and a posterior layer. This is the anterior layer and this is the posterior layer. These two layers on the upper pole of the kidney merges with each other. Okay. And then it is split. Then encloses the suprarenal gland and joins above the suprarenal gland and forms the suspensory ligament that holds the suprarenal gland and gets attached to the subdiaphragmatic fossa. So we can see the suprarenal gland and the kidney are held in two different compartments. And moreover, the suprarenal gland is hanged from this subdiaphragmatic fossa by the suspensory ligament. Okay. So in case of any downward displacement of the kidney, the suprarenal gland is not pulled down. Why? Because this is at a different compartment and this is held from the subdiaphragmatic fossa by the suspensory ligament of the suprarenal gland. Okay. Now, the next question is caput medusae. What is caput medusae? You see, this is the umbilicus, and these things that you see, this appearance is called caput medusa. What happens? Now, the veins of the anterior, the superficial veins of the anterior abdominal wall become swollen and become tortuous. Okay. Why? Because this is our paraumbilical vein, which is a branch of the left division of the portal vein. Okay. Now, you see, these are the systemic veins of the anterior abdominal wall. All these veins anastomosis with the paraumbilical vein, forming a region of porta-cabal anastomosis. Now, blood from this veins drain into this paraumbilical vein. If there is obstruction in our portal vein, what will happen? This blood will not be able to flow into this paraumbilical vein. That will result in stasis of blood at this superficial veins, which will lead to this caput medusa, okay, in which this blood lost veins will become tortuous and dilated. Okay. Okay. The next question is that the inner layer of the myometrium acts as a living ligature to the uterus during menstruation and parturition. The inner layer of the myometrium consists of some of the circular fibers and some of the longitudinal fibers. Now, when this muscle layer will contract, that will lead to the compression of the uterine, the compression of the branches of the uterine vessels. That will prevent the bleeding. So, it will act like that the branches of the uterine arteries are ligated to stop bleeding. So, this inner layer of the myometrium is called as the living ligature because it acts as the ligature to the branches of the uterine arteries and prevent the blood loss. Okay. Now the next question is varicocele of the left testis is common. Why? First of all, we have to know what is varicocele. Varicocele means the veins will get dilated and will appear tortuous. Varicocele of the left testis is common. In case of varicocele of the left testis, the veins of the pampiniform plexus will get swollen up and will become dilated and tortuous. Okay. Now, why this is common in the left testis? Because as we can see, the left testicular vein is longer and it drains into the left renal vein, whereas the right testicular vein is shorter and drains into the inferior vena cava directly. Okay. Now, this left testicular vein drains into right angle, which will give obstruction to the blood flow. Okay. But the right testicular vein drains into the inferior vena cava at an acute angle, so it will face comparatively less obstruction to the blood flow. Okay. Moreover, here the suprarenal, the left suprarenal gland drains the blood reaching adrenaline. This will cause vasoconstriction. Already the left testicular vein drains in right angle, and upon that this left renal vein is constricted, which will cause more obstruction to the blood flow. Okay. Now, what can happen? This left testicular vein can get compressed due to the loaded sigmoid colon. Moreover, if there is any carcinogenic growth in the left kidney, that will compress, okay, because this left testicular vein drains into the left renal vein, so it is very much approximated to the left kidney. So, if there is any compression of the lower pole, if there is any hypertrophy of the lower pole of the kidney, that will directly compress this left testicular vein. Okay. Moreover, the left testicular vein can get compressed due to our abdominal aorta. Okay. For all these reasons, there can be stasis of blood in this left testicular vein that will create a back pressure in the pampiniform venous plexus, and that will lead to varicocele, which is very common on the left testis. Okay. Now the next question is that carcinoma of the head of the pancreas may produce jaundice. That we have already done here. Okay. The next question reads that pain around umbilicus in case of acute appendicitis. Now, this is our anterior abdominal wall, and this is divided into a few dermatomes. Now, what are these dermatomes? Now, these dermatomes are the part of the skin that are supplied by a single nerve root, means especially by that single nerve root. Suppose this region, this is supplied by T8, so it will be mainly supplied by T8, though it will also have contribution from T7 and T9, but the main supply will be by the T8. So this anterior abdominal wall is supplied by nerve roots starting from T7 to L1, and this is our umbilicus. You see, the region around the umbilicus is supplied by T10 spinal nerve. Now the same T10 nerve carries the visceral sensation from our appendix. Now, in case of inflammation of the appendix, this T10 segment will carry the sensation to our brain, and our brain will think that the sensation is coming from the skin, because the main motto of the first primary motto of our brain is to prevent any external injury to us. So by default, the pain will be referred to the skin. Hence, in case of appendicitis, that is inflammation of the appendix, the region around the umbilicus will have the referred pain due to this T10 spinal nerve root. Okay. Now the next question is that cholecystitis causes pain in the right shoulder. Now this is also a case of very referred pain. How? Now our gallbladder is supplied by right phrenic nerve, which carries the nerve roots C3, C4 and C5. Now the same nerve roots supply the right shoulder. So in case of inflammation of the gallbladder, that is cholecystitis, the pain from the gallbladder will be referred to our right shoulder. In the same way, the pain from the appendix was carried to the skin around the umbilicus. Hence, in case of cholecystitis, we'll get the pain, we'll feel the pain, the patient will feel the pain in the right shoulder. Okay. Now, a patient of cirrhosis of liver presents with caput medusa. I think I've done this question. Yes, here. Now, the next question is, pectinate line is an important landmark of the anal canal. Yes. Why? Let's look at the diagrams. So, this is basically the anal valve. Okay. These are the anal valves, and all this anal valve around the anal canal forms the pectinate line, and the story of the anal canal above the pectinate line is different from the story of the anal canal below the pectinate line. Why? Because first of all, on the basis of development, the region of the anal canal above the pectinate line, they develops from the endoderm. This is drawn in black color, and the region of the anal canal below the pectinate line, which is showed in green, they develops from the ectodermal proctodium. Ectodermal proctodium, and the region above the pectinate line, it develops from the endoderm. So developmentally, the two regions are different. Moreover, this is called the watershed line of the anal canal. Why? Because this is our pectinate line, and the lymphatics from below the pectinate line drains into the superficial inguinal lymph nodes, and from above the pectinate line, those drain into the internal iliac lymph nodes. So the lymphatic drainage is different. So this pectinate line acts as the watershed line. Moreover, this is our venous drainage. The region of the anal canal below the pectinate line is carried by the internal rectal vein, okay, which is the systemic vein. This is drained by the internal rectal venous plexus to the internal rectal vein, which is the systemic vein. But from above, these are drained from above the pectinate line. These are drained into the superior rectal vein, which is a part of the portal circulation. Why? Because the superior rectal vein is the tributary of our inferior mesenteric vein, which is a tributary of our portal vein. Okay. Also, the arterial supply is different. The region below the pectinate line is supplied by the inferior rectal artery, and the region above the pectinate line is supplied by the superior rectal artery. Okay. Hence, the pectinate line totally demarcates the anal canal into two different parts, having different characteristics. Okay. Now, this question. Rupture of the membranous part of the urethra may cause extravasation of urine in the anterior abdominal wall. Look at this diagram, this one. This is our superficial perineal pouch, and this is our deep perineal pouch. Okay. The superficial perineal pouch is open in front, though it is covered above, below, and all other sides, but this is open in front. But our deep perineal pouch is closed on all sides. Now, when there is a rupture of the membranous urethra below the perineal membrane, the urine will extravasate into the anterior abdominal wall. How? This is the fossa of penis. This is the dartos muscle. The urine will come from here. As there is a rupture at this portion, this will come from here, will move all the way around the penis, inside the penis, inside the fossa of penis, and then this will go above into the superficial inguinal space outside the fossa of the external oblique muscle, and hence it enters, it is the gateway to our anterior abdominal wall. Hence the urine that has been leaked from this membranous urethra will first pass into the space between the fossa of penis and the dartos muscle, and then it will ascend up into the superficial inguinal space, and then it will enter the anterior abdominal wall. See, so here there is a rupture, the urine comes out, then goes all the way here, and then ultimately ascends up into the anterior abdominal wall. Okay, the next question is, incidence of the inguinal hernia is normal in normal healthy individual is prevented by Saturn mechanism. I will show this answer of one of our juniors. It was a beautiful answer. Okay. So there are few mechanisms. The first one is flap valve mechanism. The second one is ball valve mechanism. Then slit valve mechanism, Saturn mechanism, guarding of the inguinal ring, and there is one more thing. Let us look into all this one by one. What is flap valve mechanism? Now, you see the deep inguinal ring and the superficial inguinal ring are at different planes. Okay. Now, when there is a contraction of these abdominal muscles, then this will close the inguinal canal like a flap. As because these two rings are at different planes. So whenever these muscles will contract, this will close the inguinal canal like a flap. This is the flap valve mechanism. The next one is the ball valve mechanism, in which the cremasteric muscle contracts and pulls the spermatic cord up. And when the spermatic cord is pulled up, the testis will also be pulled up, and these will block the superficial inguinal ring. So the contents from here will not be able to pass this. Okay. Now there is the slit valve mechanism, in which the contraction of the external oblique muscle, this will bring the medial and the lateral crura of the superficial inguinal ring together and will close it, and this will close our superficial inguinal ring like a slit, because we know that both the medial and the lateral crura of the superficial inguinal ring are derived from the external oblique muscle. So when the muscle contracts, this will oppose the two crura together, and that will close the superficial inguinal ring. Now the Saturn mechanism. To see the Saturn mechanism, you know what is Saturn? In front of the sock, the Saturn doors are there. That means it is closed from above. The same thing happens here. This is a section of our anterior abdominal wall, in which this is the external oblique muscle. This is the external oblique muscle. It forms the inguinal ligament. Then this blue one is the internal oblique muscle that comes above the inguinal ring. This inguinal ligament means it comes below the inguinal canal, and this internal oblique muscle comes from above and arches over the inguinal canal. Okay. And also this transversus abdominis muscle come and arches over it to form the conjoint tendon more medially. So this is covering the inguinal canal from above like this, and whenever there is a contraction of this muscle, this will close the inguinal canal. This will close the inguinal canal from above. Okay, that will definitely prevent the abdominal contents from going into the inguinal canal. Okay. Moreover, our deep inguinal ring and the superficial inguinal ring are guarded, that is strengthened by some structures. Like the deep inguinal ring is guarded by our internal oblique muscle, and the superficial inguinal ring is guarded by the conjoint tendon and the reflected part of the inguinal ligament. Okay. Hence, these inguinal rings are strong enough not to let the abdominal contents pass into the inguinal canal. That's all about the explained whys from your abdomen. I hope this video has helped you a lot. If you like the video, hit the like button. And if you have not still subscribed to our channel, do subscribe now. You can also join our Telegram and follow us on Instagram. All the best for your exam. Study hard. Take care. Bye-bye.